Thank you. Good morning to everyone. Anxiety disorders and concerning cognitive functions, I'd like to share some information with you. Before I go on with my presentation, when I reviewed the literature on this subject, usually it was mostly considered in obsessive-compulsive disorders, and the neuropsychological test performances were considered widely in research. And what has appeared, there are findings which have become evidence and definite. In what areas the cognitive functions are disturbed, and also the neuroanatomy, the neurocognitive tests and contacts in that aspect was established. But in other anxiety disorders, we don't have such a wide scope of information. And in my presentation, I'll try to share all this with you. And in social phobia, we had one survey carried out in our clinic. I'd like to give you the results. Neuropsychological part has been mostly worked on. And in obsessive-compulsive disorders and also the visual, spatial functions, non-verbal memory, and also functions, managing functions. When we talk about the visual spatial competence, what do we understand from this? It's the competence to conceive a subject in 3 dimensions and make use of it. For example, to draw a cube with 3 dimensions. But in order to know all that, to be able to do that, they have to comprehend and understand the context and to be able to copy it just as the original is. In OCD, visual special competences or skills for adults, and it is the sub-test, the block design sub-test of IQ test. Ray Osterate mixed figure tests, copying, and cube copying test. There are other methods of tests or assessments, but these are the things that are well known by all of us. That is why I have to consider them. In OCD, and the visuospatial functions are showing impairment, and there are many studies on this. Another important or impaired function in OCD is the non-verbal memory. That's seeing something, learning about it, and keeping it in mind. And the visual copying test, for example, the Wechsler memory scale is one that concerns, it's a sub-test for copying. And certain subjects are shown and then taken away. They are asked to draw it down. And then other tests intervene, and then they are asked to remember it. And for example, there are 3 cards. Each card has 2, and one final card is shown. In obsessive-compulsive disorders, the nonverbal memory impairment with the Wechsler memory scale and the mental visual memory test, Ray Osterate mixed figure test. So that the tests are occurring after the figure is copied, then immediately and afterwards, after a certain duration, the individual is asked to recall, to remember what was on that. What I want to stress is that in obsessive-compulsive disorders, the verbal memory impairment is not been shown with any test. It's sort of evidence or data in that in OCD, the non-verbal material is closely related. That is, visual memory impairment exists in these individuals. And also they are impaired in acquiring and learning new memory, and also there are tests for remembering. And because no conceptual error is laid down, that recalling is impaired, remembering the information. And also executive functions in OCD has also been looked into. The executive functions, for example, the basic emotional, motor, mood, hearing, and also cognitive functions are organized and goes through a control screening, planning, organization, determining strategy, and to adapt to changing conditions. With the Wisconsin card twinning test, and with the RCFD, Osterite mixed figure test, the organization skills are looked into. And let me remind you what the Wisconsin card twins are. 4 cards are shown: a red triangle, a green 2 stars, and yellow 3 crosses, and blue 4 circles. And these are twinned and as to color and shape. And the tester knows, and based on the tester, whether it's right or wrong, the subject learns. And then, after 10 correct responses, they go on to another principle. In the WCST executive tests, abstraction, understanding the principle, bringing together 2 identical cards to continue the response, flexibility, all of these skills must exist. In OCD, the Wisconsin card sorting test showed that perseverative errors were found to increase. And there are subscores as well. And what has been most frequently upon, the dorsolateral prefrontal cortex functions are related, and usually the test points concentrate on the perseverative errors. And also the executive impairment executive function impairments are shown. Reduction in flexibility and also difficulty in transferring to another mode of thinking is difficult. OCD, and if we consider the disorder of neuropsychology, in each function there is no dysfunction, only in some we observe dysfunction: verbal memory, speaking, and intelligence. And there has been no research or survey to determine a mistake or something wrong in that aspect. Not all patients, OCD patients, don't have a cognitive impairment, and also the OCD has in some tests been found to be non-different or separate from normal people. Now, executive functions. We're talking about cortical dysfunction, Parkinson and Huntington diseases, subcortical degenerative diseases. There are symptoms similar to OCD. Parkinson and Huntington diseases show a memory impairment. It's a special type of Alzheimer. It's different from Alzheimer's disease, and it is In Parkinson, the memory impairment is rather parallel to the executive function loss in OCD. If the executive function performance are controlled, then the symptoms disappear. Ray Osterite figure shape, I talked about this as a technical problem. I can't show you the shape, but it's a rectangle, and there are triangles on the corners with equal sides. It's quite a mixed up shape. There is a flag, details, a smiling face inside, and the patients copy this, and we expect them to remember it after it has been taken away. The OCD patient in Ray Osterite figure, in remembering right after the shape is taken away, they face a difficulty, but the visual memory impairment is because of the wrong organizational strategy that the patient employs while copying the figures. There's nothing wrong with the memory. It's because when they're copying, their own system is different. And when they copy, when we look at the strategy they used, as expected, OCD in drawing lines, for example, they focus on minute details and the control, and that they use more effective strategies and first copy the main parts. In OCD, executive function impairment leads to learning and remembering errors or impairment. Also in OCD, filtering mechanism is distorted, and sometimes the stimulus is excessively subjected to attention, and also they cannot leave aside non-effective behaviors. As shown in the neuropsychological test, they get stuck on one strategy which they cannot leave and go on to an effective strategy. The anxiety, for example, impairment, agoraphobia, anxiety, 25 panic patients, for example, in 25 healthy controls were compared. The Welcher memory test, mental visual memory test, was used. In panic disorders in the right temporal lobe, structural and functional abnormalities were found. And on the right hemisphere, we know that it concerns more the non-verbal functions. In the patient group, visual memory impairment was found. But later on, Asmussen and colleagues in 18 panic disorder patients, 18 social phobia patients, and 16 healthy controls were compared. Visual memory impairment was found, and verbal learning and memory impairment was found as well. Later on, Glacier and colleagues in 69 panic attack patients were compared to 19 normal controls between the groups, visual and verbal memory, learning, attention, and also visual spatial functions were all found to be impaired. As for panic attack and concerning anxiety, neuroanatomic structures, the septo-hippocampal system that is related to the limbic area system. Septo-hippocampal system, where the campus parahippocampus exists, and in the septum, they play an important part in learning and memory. Remember, in panic attack, the septo-hippocampal anxiety model is not supported. In a panic attack, another neurocognitive deficit is attention. Dupont and friends, for example, in 2000, compared 19 panic agoraphobic patients with 22 healthy controls. And also this is done with a computer on a visual spatial study. And also the reaction durations of the two groups were found difficult. For the panic patients and for the physical situations and related stimulants were getting a lot of their attention. And there is a more recent study where 21 panic disorder patients, 21 major depression patients, and 20 healthy controls are compared, and that's visual attention. And that there are two tests, more difficult attention test, where the patient must follow up on the computer screen two separate incidences. The divided attention test, the panic agoraphobic patients are slower than the control. When a single task is requested, and then the patient and control groups did not show a difference. And the attention impairment could only be exhibited in situations that were more difficult. As I have said, in OCD, panic, agoraphobic disturbances, in literature there are some publications, but stress disorder after trauma and original phobia and so forth, I did not encounter any neurological study or neurophobic study. The social phobia, and also there are very few tests, two actually exist for determining or assessing the cognition. In 1994, Asmundsen and friends in social phobia and panic attack patients for their verbal learning and memory performances compared to the controls were impaired. And Cohen and colleagues also in the SF social phobia patients were compared with healthy and OCD patients. That anxiety impairment was not limited only to OCD, and also in the social phobia group there was an executive function impairment as well. And now we employed a test. And here we try to determine, as you know, cognitive functions must be healthy and necessary, we can say, for a social performance. And also executive functions are important, and there are some important underlying things. Social phobia patients solving problems and in social life certain functions are expected. These are the executive functions. Social phobia patients was compared to the healthy controls, were compared with the Wisconsin test. The reason we use the Wisconsin test is that we could find something more extensive, could refer to other tests as well to show the executive function impairment. But we knew how to employ this test, and also our colleague had a certificate and a thesis on this subject, and neuropsychological test that we had not tried before, so we preferred to use this. We included 36 patients, 16 female, 20 male, and 36 healthy controls. And no psychotic impairment existed. Their medical condition did not have any problem. But social phobia patients had a simultaneous diagnosis, starting with major depression, and they were taking antidepressants. Most of them were taking antidepressants, some SSRIs, and they were using psychotropic medication. And also we tried to determine and we had the Beck depression scale and conditional anxiety inventory Labot's test and Wisconsin test was employed. Your time is up. If you could conclude in a sentence or two. As you have observed in our survey, as expected, the points are high, the scale points. When we come to the result of the neuropsychological test, in the Wayne-Coston twinning test, in the patient group, it's low, they have more mistakes. Perseverative patients do not show a mistake. Non-perseverative mistakes are higher. The number, correct number, is also related to anxiety and severity of social phobia, and the non-perseverative mistakes is their anxiety levels at the moment. An important number of patients had depression, but those that had depression or did not have depression, we did not encounter any difference in these tests, and medicated and non-medicated patients did not give different conclusions. The social phobia patients have a more executive function impairment, and difference between patient and healthy group were laid down or based on non-perseverative mistakes and keeping information in mind. Functional memory is important for execution, and finding and learning new information, they have to keep other things in mind. So as a result of this survey, in the Wisconsin twinning test, we found that non-perseverative mistakes were higher than the control group, and so that executive function